Treasurer Chris Steele, thank you so much for your time. The health levy, it's been reduced now to $100 for residential properties, but it still remains. The original $250 figure though, how did the government come up with it and why wasn't there some sort of means test applied?
Well, in the budget, we've made a significant investment in our health system to support growing demand and cost in delivering health services, in particular through our hospitals. And so we've always used our own source revenue through payroll tax, but also through rates to support the delivery of those services sustainably. Because of the size of the extra investment that we've had to make, we have asked households to make a contribution as well as businesses to the extra costs of running that system. And so as part of a range of measures that we took in the budget, we're asking those homeowners who own higher value land to contribute more. We've provided concessions for low income households, but we've also asked Canberrans who are ratepayers to pay a $250 flat levy. We've now reached agreement with the Greens that that would be reduced to $100 for residential, but it would still apply at $250 for commercial ratepayers. And it took into account also the economic conditions where we have lower inflation, lowering interest rates, and also tax cuts by the Commonwealth that are kicking in, which will provide more room for households to be able to contribute.
Were you surprised by the community, the political pushback on this, or did you expect you'd have to renegotiate?
Well, we work in a minority government with a parliament where there will always be different views on major issues like the budget. I don't think the Greens quite contemplated the impact of pledging to vote against the entire rates revenue of the Territory. And so as a responsible government, we worked very quickly with them through a negotiation to come up with an agreement to make sure that there was that sustainable revenue to support the critical health services that our community expects to be delivered, and as well as other community services as well, through both a contribution from households through a $100 levy for health, but also through an increase in payroll tax for big businesses with a payroll of over $150 million.
Given the government's approach to revenue previously, changes in the tax system, switching away from stamp duty to higher rates, can you not understand why so many people were surprised by this health levy?
Well, general rates will still go up by 3.75%, but we have had to take those additional measures that I mentioned to make sure that we've got a sustainable revenue base. The time is right with economic conditions to make an adjustment to our fiscal strategy to make sure the budget is on a sustainable path. And the budget I delivered last week will provide a path back to surplus over the forward estimates, which is critical to maintaining the support for new infrastructure, the work that we're doing to invest in the healthcare system and a range of other community services.
Through the federal election, we've heard so much about universal access to healthcare through Medicare. Does this not amount to a co-payment for health services?
No, states and territories have always contributed to the cost of delivering healthcare through their own source revenue, and that's what we have done through the budget. As we've made an additional investment of $1.19 billion, we have had to make sure that there is revenue to be able to fund those critical services which the community expects. The alternative was to slash and cut those services. That wouldn't be in line with Canberrans' values, and it was rejected at the federal election in May.
Federal Labor have pushed back on the health levy itself. Were you surprised by that? Are they wrong?
Well, we will continue to work with the federal government. They've been very clear that there's pressure on the NDIS program, and we're willing to work with them on that. But they also need to recognise that there is extraordinary pressure on hospital systems here in the ACT, but also delivered by other states and territories, and that will be part of a negotiation that we hope will get underway as soon as possible on a new 5-year health agreement that will provide a greater share of Commonwealth contribution to the cost of running hospitals. At the moment, that share has dropped to the lowest rate that it has been since 2013, since that National Health Agreement was signed. and it's critical that to support this extra investment, there is a greater Commonwealth contribution to that. They've provided an additional $50 million through a one-year agreement, but the investment that we've made in the budget is $1.19 billion. So we will be talking with them about a contribution to the cost of that system.
Do you think the health levy would have been easier to swallow for ratepayers if there was a substantial increase in health funding?
Well, we will certainly be reviewing the health levy on an annual basis, and that will take into account whether we've been able to reach agreement on a new national health agreement with the Commonwealth where they provide a greater share. The agreement that had been reached at National Cabinet was 45% contribution by the Commonwealth, but that could drop as low as 33% and is the lowest in the country out of all of the states and territories at the moment. So there's extraordinary pressure on our healthcare system. It needs to be funded now, and we've taken responsible measures in the budget to do that.
Can you guarantee the health levy will expire in 4 years?
Well, it is a temporary levy, and we will make a decision in each budget about whether we need that revenue to support the extra investment in hospitals and other community services. But that investment is $1.19 billion. It's significant. That health levy of $100, it would raise just over $80 million over 4 years, and so isn't going to meet the full cost of that additional investment that we're making in health.
So levy will likely have to go beyond 4 years?
No, we will review that in the context of the negotiation that we have. If the Commonwealth makes a greater contribution, that would be taken into account. But we do need to make sure that we can fund the critical services that Canberrans rely on. And it's not just to meet growth and demand, it's to deliver additional services like our commitment to support 70,000 elective surgeries, provide more support for people with chronic illness and other health services.
Businesses are still going to have to pay the $250. Their commercial rates have also increased. Is this not going to disincentivise growth of businesses?
There's good reason to establish business in the ACT, and we've got the highest net growth of business in the country. And we'll continue to work with our business community to make sure that the settings are right. But the agreement that we've come to is that big businesses will pay more, and our payroll tax settings are still more favourable for small businesses than they are in New South Wales for businesses with a payroll of under $4 million.
You've previously argued that the Greens' proposal for a higher payroll tax rate for big businesses like supermarkets, the airlines, that would cause prices, services to cost more. How has your thinking changed on that since those negotiations with the Greens?
Well, we haven't agreed with their proposal to charge double the amount of payroll tax for big business than what New South Wales charges. What we've agreed to do is to establish a new tax bracket that would be 1% larger than for other businesses in the bracket below. So it's a small amount extra that will contribute towards the cost of delivering critical services, particularly in the hospital system.
Is it likely to increase prices for services and for goods?
Well, I don't think it will have that impact, but of course we'll continue to monitor the impact of all the measures that we've taken. But we were concerned about a very large increase that the Greens had proposed. We're not proposing that large increase in the change that we've made.
So why not go down this path in the first place?
Well, we've considered the range of measures and looked at all different own source revenue lines. We have taken in the budget decisions around payroll tax to broaden the base of payroll tax, which also meant that big businesses were paying more, but a larger number of businesses would also be paying payroll tax, including some for the first time. That contributed an extra $171 million to support the investment that we're making in hospitals. But we also have asked households to make a contribution. I think most Canberrans understand the need to be able to support these critical services that we all use. And so we've made that decision to provide a range of measures across the budget to provide a sustainable revenue source for the Territory, which I think Canberrans also understand is limited for the ACT government. It is the Commonwealth that raises the majority of taxes in this country. I think the broader issue, though, is that vertical fiscal imbalance is becoming more of a problem in Australia. It's the states and territories who deliver the frontline services in health and education and so many other areas. And so I think it is time to have a national conversation about how we make sure that we do have a sustainable funding base to support those services.
Do you need to have more of a conversation with your counterparts in New South Wales about the services that we provide to residents that come into the ACT, be it health or education or others?
Well, at any one time, there could be up to 25% of patients in our hospitals who are from New South Wales. But of course, also Canberrans use hospital services, particularly specialised services in Sydney as well. As part of a negotiation with the New South Wales government, we would like to see them recognise the actual cost of delivering hospital services and episodes of care. Currently, that's based on the efficient price methodology that's contained in the National Hospital Agreement, and that simply hasn't recognised the increasing cost of delivering care. There's a cap of 6.5%. But our investment is over 11% extra this financial year, and we're seeing that right across other states and territories as well. So there is a need to look at the entire methodology of funding with the Commonwealth, but also between states.
Handing down your budget, you're committed to maintain those major infrastructure projects like light rail, arguing that they will have flow-on economic impacts. Is there a point, though, is there a red line where the debt and deficit's simply too high and you have to look at winding those back?
Well, the major impact that we've faced in the budget has been around hospital growth and expenditure of costs in delivering episodes of care, and so we've responded to that in the budget. We've continued our investment in infrastructure. We haven't made deep cuts either to services or our infrastructure program, but we have shaped our infrastructure program to make sure that it is achievable and deliverable, that it targets areas of economic growth, and that the investment that we are making is in generational infrastructure that will benefit our community for decades to come and support the growth in population that we're experiencing in the ACT. We need to continue to deliver key infrastructure projects that support more housing, which is also a priority in the budget. And so we haven't stepped away from that, but we have shaped the program to make sure it's deliverable. And the level of net debt where we pay for our infrastructure at the moment is comparable on average to other states and territories.
Will the budget that you handed down fix the underlying structural problems within the ACT economy, within the budget?
The decisions which were quite difficult and that we didn't take lightly in the budget to adjust our fiscal strategy to provide sustainable revenue sources, but also to make sure that we're lowering the growth in expenditure in the public service, have meant that we can return to surplus over the forward estimates, which is critical for the continued support of delivery of critical services, but also investment in the infrastructure program going forward. Over in the mid to early 2030s, we will see the ACT government paying down our outstanding superannuation liability, and that will provide further room in the budget then to be able to make payments to pay down net debt and some of the infrastructure investment that we need to make today in order to support that population into the future.
Can you rule out future surprise levies, be it an education levy, a tram levy?
This budget has delivered quite difficult decisions in challenging circumstances, and so we think we have taken the decisions we need to be able to put the budget on a sustainable footing. Of course, there are always issues that arise. We've had pandemics and natural disasters where the government had to step in over recent years. We're now in an economically stable situation. We hope that that will continue. We'll need to make decisions based on the context of the situation that we're in every budget. But at the moment, we think we're tracking back to surplus. We've made tough decisions around revenue sustainability that will put us on a strong footing to be able to make sure that we can continue to deliver the services that Canberrans expect while delivering on our election commitments and what the community expects us to do.
Treasurer Chris Steele, thank you so much for your time.
Thank you.